Principles of Proprioceptive Neuromuscular Facilitation (PNF). All human beings have potentials that are not fully developed. Motor activity is limited to the individual's physical ability and inherent and previously learned neuromuscular responses. However, the normal person has a vast and untapped neuromuscular potential which may be developed through environmental influences and voluntary decisions or tapped during stressful episodes. Based on this philosophy, the therapist always strives to treat function, motivate the patient to achieve higher levels, and uses the patient's strengths to minimize his or her weaknesses. Normal motor development proceeds in a servo-caudal and proximo-distal direction. Development of motion occurs first in the head and neck, then in the trunk, and finally in the extremities. Motion develops from proximal points to distal points. During treatment, the head and neck are treated first because they influence the movement pattern of the body. Next, the trunk is treated because it provides foundation of function. After adequate control of the head, neck, and trunk is established, fine motor skills may be developed. Early motor behavior is dominated by reflex activity. Mature motor behavior is reinforced or supported by postural reflex mechanisms. During treatment, reflexes may be facilitated to support weak muscles by choosing a specific developmental posture, initiating part of a functional activity or pattern, or involving the head and trunk with extremity patterns. The growth of motor behavior has cyclic trends as evidenced by shifts between flexors and extensor domination. During functional activity, movements alternate between flexion and extension. This reciprocal relationship leads to stability and balance of postures. In treatment, the reciprocal relationship of flexors and extensors may be facilitated to re-establish stability and balance. Goal-directed activity is made up of reversing movements. Normal movements are rhythmic and reversing. Reversing movements establish an equilibrium among activities and establish a balance and interaction between antagonists. Treatment must facilitate movement in both directions to enhance functioning. Normal movement and posture depend on synergism and a balanced interaction of antagonists. Functional movement relies on a balance of reflex activity, flexor-extensor dominance, and reversing movements. During treatment, imbalances among these factors are correlated to restore normal patterns of motion and postural responses. This may be achieved by performing transitions between postures, example, rolling reversals, supine to or from sitting, performing reciprocal or reversing patterns. Developing motor behavior is expressed in an orderly sequence of total patterns of movement and posture. Motor behavior develops in a specific sequence. During development, early milestones provide the basis for more complex function. Motor behavior progresses in an orderly fashion from mobility to stability to controlled mobility and into skill of function, creating a diverse repertoire of motor behavior. Combined movements of the neck, trunk, and extremities also progress in a specified sequence. Treatment must progress symmetrical. Perform like movements at the same time. Asymmetrical. Perform movements toward one side at the same time. Reciprocal. Perform movements in opposite direction at the same time. Combine movements of upper and lower extremities. Ipsilateral. Extremities of same side move in same direction at same time. Contralateral. Extremities of opposite sides move in same direction at same time. Diagonal reciprocal. Contralateral extremities move in same direction at same time while opposite contralateral extremities move in opposite direction. These figures show interaction of segments.